Hello, welcome to the Pars Health TV channel. We hope you're having a good day and you are happy and healthy. In this channel, we give you tips to keep you healthy and out of trouble. In this video, we want to talk about how to fix a groin pull. This video is for educational purposes only, and if you have any specific condition or illness, you should consult with your doctor. A groin strain is an injury or tear to any of the adductor muscles of the thigh. These are the muscles on the inner side of the thigh. Sudden movements usually trigger an acute groin strain, such as kicking, twisting to change direction while running, or jumping. Athletes are most at risk for this injury. Groin strains aren't usually serious, although a severe strain may take a long time to recover from. In today's video, we are going to be sharing with you its symptoms, causes, and 9 stretches that will help you to fix it. So, stay tuned with us. If you like topics like this, make sure to subscribe to our channel and press the bell icon to see daily videos just like this one. Alright, let's get started. A groin pull or groin strain results from putting too much stress on muscles in your groin and thigh. If these muscles are tensed too forcefully or too suddenly, they can get overstretched or torn. Groin pulls are common in people who play sports that require a lot of running and jumping. In particular, suddenly jumping or changing direction is a likely cause. Groin pulls often appear in people who play soccer and football, and they make up about 10% of all injuries in professional hockey players. Symptoms. Symptoms of a groin strain can range from mild to severe, depending on the degree of the injury. They can include pain usually felt in the inner thigh but located anywhere from the hip to the knee, decreased strength in the upper leg, swelling, bruising, difficulty walking or running without pain, snapping sounds at the moment of injury. Causes. Groin strain is most common among both professional and recreational athletes. It's often caused by straining the adductor muscle while kicking, so it's more common in the athlete's dominant leg. It can also be caused by turning quickly while running, skating, or jumping. Movements that require your muscle to both lengthen and contract at the same time usually cause a groin strain. This puts stress on your muscle and can lead it to overstretch or tear. Although sports are the most common cause, a groin strain can also occur from falling, lifting heavy objects, other types of exercise, such as resistance training. Any overuse of a muscle can lead to a long-term strain. Number 9. Hip adductor stretch. This exercise targets your inner thigh muscles. If you have a lot of tightness, place cushions under your knees. Lie on your back with bent knees. Press your feet into the floor. Allow your knees to drop open to the sides. Press the soles of your feet together. Hold this position for up to 30 seconds. Return your knees to the starting position. Repeat 3 times. Number 8. Hamstring stretch on wall. This exercise stretches the back of your thigh. Position yourself on your back near a doorway. Extend your unaffected leg in front of you on the floor of the doorway. Place your affected leg along the wall next to the doorframe. Hold this position for up to 30 seconds. Repeat 3 times. Number 7. Straight leg raise. This exercise builds strength in your thigh muscles. During this exercise, engage your thigh and leg muscles to keep your leg straight. Lie on your back with your legs extended. Bend the knee of your unaffected leg. Press your foot into the floor. Engage the thigh muscles on your affected side. Raise your leg 8 inches from the floor. Slowly return your leg to the floor. Do 2 sets of 15 repetitions. Number 6. Resisted hip flexion. You'll need a resistance band for this exercise, which builds strength in your thighs. Stand with your back to a door. Make a loop and place the resistance band around the ankle of your affected leg. Place the other end of the resistance band around an anchor point. Engage the front of your thigh and keep your leg straight as you extend your leg forward. Slowly go back to the starting position. Do 2 sets of 15. Number 5. Seated short groin stretch. While seated on the floor, bend the knees, and bring the soles of the feet together in front of you. With a straight back, use your elbows to gently push your knees toward the floor until you feel a light stretch in the inner thigh, and hold the position. Number 4. Bent knee adductor exercise. Lie down with your knees bent and feet flat on the floor. Use a small medicine ball placed between the knees to create resistance, and squeeze for 5-second intervals. Repeat 10 times, and increase the duration and number of repetitions as strength improves. Number 3. Straight leg adductor exercise. Remain in a reclined position, and extend the legs flat on the floor. Place the medicine ball between the ankles, and repeat the squeezing exercises outlined above. Number 2. Hip adduction against gravity. Lie on your side on the floor with the top ankle resting on the seat of a chair and the bottom leg under the chair. Slowly lift the bottom leg to touch the bottom of the chair seat, pause briefly, and then lower the leg back to the floor. Perform the exercise 10 times on each leg, and repeat 3 times a day. Number 1. Hip adduction with resistance bands. As groin strength improves, you can add more resistance to hip adduction exercises with bands. Secure one end of a resistance band around your ankle and the other end around an object that will not move. Standing on the opposite leg, position yourself so that the resistance of the band will increase as you gently swing your leg toward the centerline of your body without bending the knee. Do 10 repetitions on each side, and increase the number as strength improves. How to prevent groin strains. To prevent groin strains, take care when exercising or doing any strenuous activities. This is especially important if you've already had a groin strain or have muscle weakness in this area. If you've taken a break from a sport, start slowly once you resume the activity. Gradually increase the intensity and duration of your workouts. This helps you gain the strength and flexibility needed to support healthy movement patterns. You may want to work on improving your endurance and range of motion in your lower body, too. Always include a warm-up and cool-down in your workouts. Another way to prevent groin injuries is to keep your core strong and engaged. A weak core has been shown to predispose individuals to groin injuries. To assist tissue healing, your medical provider will guide you in active stretching and strengthening exercises. Depending on the grade of injury, this can start immediately or may require several days of rest. Pain is used as a guide. Too aggressive and further damage may occur. If you are interested in videos like this, make sure to like this video and subscribe to our channel. We hope you have a wonderful day. See you in the next video.